Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. Systematic review shows antibiotics, vaccinations and anti-inflammatories may lower dementia risk. Antibiotics, antivirals, vaccinations and anti-inflammatory medications are associated with reduced risk of dementia according to new research that looked at health data from over 130 million individuals. In a study published in Alzheimer's and Dementia, Translational Research and Clinical Interventions, researchers led a systematic review of existing scientific literature to look for evidence of prescription drugs that altered the risk of dementia. In total, the team examined 14 studies that used large clinical data sets and medical records capturing data from more than 1 million dementia cases. Although they found a lack of consistency between studies in identifying individual drugs that affect the risk of dementia, they identified several drug classes associated with altered risk. One unexpected finding was an association between antibiotics, antivirals and vaccines and a reduced risk of dementia. This finding supports the hypothesis that common dementias may be triggered by viral or bacterial infections and support recent interest in vaccines such as the BCG vaccine for tuberculosis and decreased risk of dementia. Anti-inflammatory drugs such as ibuprofen were also found to be associated with reduced risk. Inflammation is increasingly being seen to be a significant contributor to a wide range of diseases, and its role in dementia is supported by the fact that some genes that increase the risk of dementia are part of inflammatory pathways. The team found conflicting evidence for several classes of drugs, with some blood pressure medications and antidepressants and to a lesser extent diabetes medication associated with a decreased risk of dementia and others associated with increased risk. Dr. Ileana Lorida from the National Institute for Health and Care Research, Applied Research Collaboration Southwest Peninsula, University of Exeter said, because a particular drug is associated with an altered risk of dementia, it doesn't necessarily mean that it causes or indeed helps in dementia. We know that diabetes increases your risk of dementia, for example, so anyone on medication to manage their glucose levels would naturally also be at a higher risk of dementia. But that doesn't mean the drug increases your risk. It's important to remember that all drugs have benefits and risks. You should never change your medicines without discussing this first with your doctor, and you should speak to them if you have any concerns. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.